Just want to tell you a little bit about Zumbro Valley Health Center. As you probably all know, mental health has had a very, very long history of poor treatment, stigma, institutional care. In the 1970s, state hospitals were shut down and the state created 6 smaller 16-bed regional hospitals. And that was really the birth of community mental health centers. So Zumbro Valley Health Center has been a safety net mental health center for over 55 years. Mental health currently is very fragmented, a lot of very difficult for people to get care in one place, underfunded, long waits. The average time to get an appointment, even for a therapist, is over 50 days. And then especially for people who have no insurance, public insurance, a lot of social determinants of health, housing insecurity, just a lot of issues, because a lot of providers don't take medical assistance, for example, or underinsured. In 2016, the federal government, which was really watching what was happening, and did a pilot. And so 8 states were chosen. Minnesota was one, and Minnesota picked 6 agencies to pilot this program, and Zumbro Valley was one. Since then, it's called CCBHC, Certified Community Behavioral Health Centers. And now it's growing. There's like 12 in the state, wildly successful. A couple things that really set us apart, and I'll go through our the services. One is that we prioritize people on medical assistance or don't have insurance. And so we tend to serve people who have more issues, maybe more severe persistent mental illness, substance use, and housing. And then the other difference is we have an integrated care model. One care team, we prioritize access, same-day access, walk-in access, one care team, one care plan, coordinate all the services. That's really the difference. So the services that we provide at Zumbro Valley, some are in the CCBHC, some not, but we have a regional secured withdrawal management unit. There's only a handful in the state, 22 beds. We serve ages 12 and up. Really short stay, 2.5 days, 24/7 nurses, a psychiatrist available all the time. We have an inpatient residential treatment, so up to 90 days, 18 and older. We have 4 inpatient crisis beds for adults, so people can stay for 10 days, any type of crisis. We also have the 24/7 mobile crisis response, so we have staff out in the community in the region 24/7. We have psychiatry, so we have 4 providers. We can serve clients 13 and up, so any kind of community psychiatry. We have an integrative medicine program so we have a Mayo-trained integrative medicine physician, and we oversee that program, resilience, tobacco cessation. We used to think, 40 years ago, well, at least people are just smoking. We really know now that tobacco interferes with all the meds, causes anxiety. So we really try to help people. We use our donations to provide healing touch Reiki with Mayo providers, wellness programs, biofeedback, really trying to provide modalities to clients who would not have the opportunity after that. All of our clients have care coordination, so we follow up. We get alerts from the hospitals. If they're in the ER or the hospital, we follow up within 7 days. We did over 370 last year. We know that the first 7 days after following a hospital or ED with a suicide attempt, 300% higher chances of having that happen again. So really important to follow up. We do social determinants of health screening on all our clients every 6 months. We close a loop on about 1,600 clients last year for food, housing, goods, transportation. We closed over 1,000 preventative health services. So we also look at, hey, you're due for a mammogram, you're due for your doctor's appointment, let's get your immunizations, really focusing on that for our clients. We have an on-site pharmacy, and we filled over 12,000 scripts last year there. We can fill all our clients' meds. We have a 98% med adherence rate for antipsychotics for clients who get their meds filled at our pharmacy. Huge issue in mental health to get people to stay on their meds. We have Apple Tree Dental on site every week, which is amazing. Minnesota and especially Rochester actually has more dentists than we need per capita. but only a couple serve medical assistance, so no access for those clients. So that is amazing. They can get their dental care, cleanings, oral exams, extractions, fillings. We work with Goodwill Easter Sales, so we have an employment support. So our clients help them look for a job, get a job, keep a job. They're embedded in our staff. We do therapy for kids and adults. We're in about 8 schools, RCTC. We have substance use, outpatient, co-occurring for adults and teens, skill building. We have certified peers. We have quite a few. So we have mental health certified peers, recovery peers, and family peers. So people with lived experience have training. They're embedded in our team. And then we're also a licensed housing support provider. So we provide housing stabilization for several hundred clients in Rochester, scattered site, really successful. We can help them find housing. The people who have mental health issues or others, we can provide support. We have some specific population programs, LGBTQ, Somali, Southeast Asian, case management. We have 3 locations in Rochester, 1 in Harmony. We were one of the first in the region to win the Equity Leader Award. An award we also for support of veterans and active service, best place to work, 3 years in a row. We just opened a few months ago, the Northgate Clinic. Used to be the Northgate Health Club. We still have people coming, wanting to join the gym, and the pool's filled up, so there's no pool there, but that's a really good walkable site on the bus lane. And we just received a $600,000 grant from the federal government to expand our inpatient IRTs to have single rooms, more treatment space. That should be open in April. Client success stories, really a lot of our clients are long-term, stay on your meds, stay housed, stay sober. Our greatest need, I know that was one of the questions, we do take donations for. We provide bus passes, gas cards, personal care items for clients to, with hygiene, basic clothes, those type of things. Our donations all of them go directly to client care. So we do have a kind of a basic needs closet at our sites too that we can help for clients. So thank you very much. We have great partnerships with everyone else who's speaking. So we're really fortunate in Rochester to have such a great network of care. So thank you.
Thank you, Beth, for joining us and sharing. I know what you shared just touched on the comprehensive work that Zumbro Valley Health Center does. So thank you. And I know also as we hear from more speakers, as Beth mentioned, you'll hear how each of these individuals and their organizations really truly are working together to provide comprehensive and thorough services. We are excited to learn more about the important work that Nexus Family Healing does from Nicole Muchek. Nicole is the Executive Director of Foster, Adopt, and Community Services at Nexus Family Healing, which is the operating partner of the Southeast Regional Crisis Center, or CIRC. Nicole led the opening of the center in 2021 and continues to oversee its operation. Her expertise includes behavior therapy, crisis intervention, trauma therapy, and she has obtained her master's degree in mental health. Good morning and welcome, Nicole.
Thank you, Jennifer, and thanks everyone for having me today. I do have a slide deck that I'm hoping that I can share, if that's okay, Jennifer. I'll share that real quick.
Should be able to.
Awesome. So just to start here with the Southeast Regional Crisis Center, the Southeast Regional Crisis Center started in July of 2021. We opened our doors, and this was an unprecedented collaboration amongst many of the individuals on this call that are speaking today, but with the 10 Crest counties in Southeast Minnesota, as well as Mayo Clinic, Olmsted Medical Center, and some of our payers and partners with Blue Cross Blue Shield and UCare. NAMI also being a sponsor of the Southeast Regional Crisis Center with peer supports that are directly embedded in the Crisis Center. And we work alongside the mobile crisis teams. So as Beth mentioned, the mobile crisis teams that Zumbro Valley has are part of the work that is happening at the Southeast Regional Crisis Center as we partner alongside them to provide this service to the community in Southeast Minnesota. Just to tell you a little bit about the purpose of the Crisis Center, the Crisis Center was built to provide 24/7 mental health access to create stability for residents of Southeast Minnesota experiencing distress. We do this by providing non-judgmental expert care, collaborating with partners for continuity of services, and promoting emotional well-being within the community. So this is really the mission of the Crisis Center as we got started in 2021 and continues to evolve as we look at community needs and what that needs to look like as we continue forward. When we talk a little bit about the services that are provided at the Crisis Center, we have that 24/7 walk-in component. Individuals can be brought in, they can walk in, they can call and receive immediate mental health intervention services with an assessment as well as a crisis intervention if necessary. We partner alongside also the DECO team and others that will help individuals safely access the services in the front end of the Crisis Center. And I just included a few of the highlights there around our overall increase that we've continued to see year over year at the Crisis Center and some of the training that has gone in as we've learned the individuals that are accessing the center are primarily those experiencing suicidal ideation. So we've added in some components to help train our staff and build those skills in crisis management. We also have crisis residential services. This is short-term crisis residential. We have 16 beds, 8 specifically for youth ages 10 to 18, and we have 4 specifically for adults, and we have 4 swing beds. We have primarily seen that those swing beds are used for adults. So we're primarily seeing that our split is 8 adults and the 8 kids within our bed makeup. But we did start with the intention of having the ability to meet community need at any given time if youth services were needed more frequently than the adult services. And as Beth mentioned, Zumbro Valley also has 4 of these beds that are available for 10 days. And so we partner many times when there's not access at one of the places that we can hopefully help them get into a facility close by, which would be Zumbro Valley. We also don't provide detox through our residential services. And so we partner many times with Zumbro around their detox services, and then individuals following a stay in detox can return to the Crisis Center if mental health stabilization services are necessary. So that relationship is very strong there with the Crisis Center in Zumbro Valley. We also offer crisis bridging services, as Beth mentioned, that it's very difficult at times to get into therapy as well as psychiatry services within our area. And this bridging service has allowed for individuals to get access to therapy, diagnostic assessments, family therapy, as well as psychiatry for adults and youth in a bridging way. So helping them to bridge the gap to get to a community provider. Our goal is never to be someone's longstanding provider, but to help establish a relationship with a community provider within the 10 counties so that individuals can get that access in their community where they live. But that being said, we know that access is difficult. And so we're trying to help bridge that gap for individuals that are accessing the Crisis Center. Just a little bit on the data. When we look at how we did in 2023, we served 1,134 unique individuals and completed 1,408 assessments. So we saw an increase overall in 2023 with our individuals coming into the Crisis Center and receiving services. The majority of individuals that are coming in are individuals ages 18 and older. As you see, the 962 of those 1,408 assessments were ages 18 and older. In our residential services, we served 521 unique individuals, which resulted in 661 total enrollments. So we did have a return rate of about 21% of individuals coming back into residential services at the Crisis Center. So you'll see that there. And then our bridging services, we served 296 unique individuals through those bridging services to be able to help provide that stopgap for those services. Just did a quick yearly comparison on, as you see the growth there from 22 to 23. We had an increase from 1,068 assessments in 22 to 1,408. So in all of our services continued to grow in 2023. So the need for these critical services during a mental health crisis continues to be present. Again, just the primary reason individuals are seeking services at CERC is suicidal ideation. But when we look at the reason individuals are saying that they are seeking services, the primary and secondary reason, depression, is definitely number one there for individuals that are experiencing a mental health crisis, experiencing symptoms of depression. But suicidal ideation is the number one primary reason individuals are accessing services at CERC. Our number one referral source is individuals walking in, second there being hospitals and emergency departments. And then when we looked at time that individuals are coming in and accessing these services, it's still weekdays. So we are available 24/7. That includes weekends. It's been a little bit of an anomaly that individuals haven't come in more often on weekends when services are less available. But we do see that many individuals are coming in on weekdays, Tuesdays being the primary day. So we did have an influx of individuals, actually, just speaking to our data yesterday, where the crisis center is one bed away from being completely full at this point in time. So I'm not sure what it is about Tuesdays within our community, but it seems to be an area of need. And then on average, individuals are accessing the crisis center from the hours of 10 to 5 primarily. And then just included a few items around what people are saying about the crisis center. A few individuals saying things such as, I forget sometimes there are good people in the world. You guys are good people and help me a lot. Tell the staff, thank you. I'm doing much better now. I was really struggling when I was there, but let everyone know that I'm doing good now. So we have individuals calling back in and just communicating how valuable the service has been to them in their moments of crisis, and that the connections that are able to be made are helping them to withstand remaining in their community post intervention and stabilization. And I know the last ask was really around what are some of the needs, and Beth really hit some of the needs that I think we share as well with regards to transportation. And just even in the Rochester area, bus passes, the ability to help individuals navigate getting to and from appointments that we can help them establish while they're at the crisis center, to establish long-term care providers that will help them reintegrate into the community, is really an area of need, not just within Rochester, but also within the other counties as well. But Rochester specific, there's not bus routes that are accessible 24/7 when individuals may need access to go and get things and do things. The other thing would be we do serve individuals regardless of their ability to pay. And so serving that uninsured or underinsured population and just that ability to continue that work for the individuals accessing the center. As about 60% of the individuals that access the center in 2023 were from Olmsted County specific, and a number of those individuals struggle with things such as insurance copays, the ability to pay high deductibles, and receive services if they don't have insurance or are experiencing homelessness or other issues around housing. And so I would say that those are some of the big need areas that we have at the Southeast Regional Crisis Center.
Thank you, Nicole. Thank you for sharing. And it's incredible when you think of the fact you shared really rich data, and the center's been open for 2 years. a little over 2 years or
Mhm.
around 2 years. And so looking at the incredible role that you've been able to play over the last 2 years is so impressive. And the support that it does give to other providers, to Zembro Valley and other providers who before just, were not able to handle either the number of people or different things. So we're grateful to have you in our community. So thank you.
Thanks, Jennifer.
It is my pleasure to introduce Matthew Borngard, who serves as the Executive Director at NAMI Southeast Minnesota. Matthew found his way to NAMI after his own mental health journey. About a decade ago, when he was diagnosed with general anxiety and persistent depressive disorders. Prior to his diagnosis, as so many do, he felt alone, confused, and ultimately turned to self-medication to reduce symptoms. Over the past several years, Matthew's added tools to his mental health toolkit to better understand and treat his symptoms, and he is excited to share his story with others. Welcome, Matthew. We're excited to learn more about what NAMI has going on in our community.
Thank you, Jennifer. Appreciate it. Good morning, everyone. Yes, my name is Matthew Bjorngard. I'm the Executive Director for NAMI Southeast Minnesota. A little background, NAMI Southeast Minnesota is part of the National Alliance on Mental Illness, which is the nation's largest grassroots mental health organization. We're an organization dedicated to building better lives for people affected by mental illness. And we are actually one of about 600 local affiliates across the country. We currently serve a 7-county area in Southeast Minnesota. A couple of things that make us unique. Number one, we offer all of our programs and services at no charge to individuals and families. We do not bill insurance. We do also offer services that support the family members who are supporting loved ones who have a lived experience with mental illness, not just the individuals. And then thirdly, this is typically, I think, a big misconception. We are not a mental health care provider. We are not a crisis service. We are a group of individuals with lived experience and a group of family members of those with lived experience with mental illness. So for us, our expertise is experience. Our programs are led by people who've been there. As I mentioned, some of us live with our own mental health conditions. Others have family members who do. And our programs are different because many of us understand the issues firsthand. Just briefly, our programs and our services kind of fall broadly into 4 different pillars. There's support, education, advocacy, and then engagement. When we look at support, our support services include things like support groups, one-on-one peer support, and one-on-one family support. Our one-on-one peer support in particular offers supportive relationships between people who have lived experience with mental illness. Peer support emphasizes the acquisition, the development, the enhancement of skills needed to move forward in recovery. And then when we look at something like our support groups, again, those are for individuals as well as family members of those with mental illness. And these offer a safe space for folks to share ideas and insights and encouragement, and a trained facilitator with lived experience leads each of those meetings. From an education perspective, we do offer access to a variety of classes about mental illness and treatment and resources. And I'll actually talk a little bit more about that in a second when talking about some of the latest trends that we've been seeing. The third pillar, advocacy. We work at both the state and the local level to work to improve treatment and services for people with mental illness. We support increased funding for research, and a lot of that revolves around sharing our own stories. And then finally, engagement. Very simply put, we take pride in getting out in the community, promoting mental wellness, engaging in public efforts to raise awareness, reduce social isolation. But I also want to be very clear that our organization and our programs and our services are not meant as a replacement, but really a complement to the roles of therapists and case managers and other members of a treatment team. Research shows that support from peers with lived experience is effective for supporting the recovery from mental illness. That sense of mutuality that's created through thoughtful sharing of experience is really influential in modeling recovery and offering hope. And that has certainly been the case for me as I've gone through my own mental health journey. So going back to what I mentioned with education and some of the trends that we're seeing. So as I think we are all aware, over the years, mental health has, kind of emerged from the shadows. I know, Beth, you gave a bit of a history of mental health care in Minnesota. And we're getting to a point now where in more places, people understand mental health simply as an aspect of overall health. Spending on mental health services among Americans with private health insurance has really surged since the start of the COVID-19 pandemic. Paradoxically, suicide rates continue to climb. Students report higher and higher levels of emotional distress. Adults report their quality of life decreasing, and really no one is immune. Distress cuts across ages, races, sexes, genders, and really every other identifying characteristic. The need for mental health services expands while things like stable, reliable funding sources tend to shrink. And simultaneously, there are a lot of overburdened providers who claim that part of the demand stems from maybe other issues being mischaracterized as mental illness. And to that point, efforts to raise mental health awareness are, they're leading to more accurate reporting of previously unrecognized symptoms, which is a huge win. However, there's something called the prevalence inflation hypothesis. I had to write that down so I could remember how to say it right. That suggests that the awareness efforts are actually leading some individuals to interpret and report milder forms of distress as mental health problems. And this was actually reinforced by several of the external stakeholders that we reviewed as part of our latest strategic planning process. And it was also indicated in the community health improvement plans from across Southeast Minnesota. One of our interviewees even said that because we haven't clarified mental health versus mental illness, it's putting a lot of pressure on the system and an already stressed workforce. And a common reason for even not seeking care, which is cited in the community health improvement plans, was just not knowing if an issue was serious enough. So a big implication of this is that we need to approach mental health within the context of overall well-being and use and teach consistent definitions for mental health as well as for mental illness, which kind of leads me to some of our upcoming initiatives, future plans. As I mentioned, we recently went through a process for developing our newest 3-year strategic plan. And I'll just quickly walk through 3 of our main strategic objectives over the next 3 years that relate back to some of these trends and implications that we're seeing. So number 1 is that we want to connect individuals and family members to appropriate, accessible, high quality services. As I mentioned, there was a reoccurring theme in some of the latest trends that people don't know when to get mental health care, they don't know where to go. And again, the mental health system is facing pressure from people over-identifying with diagnosable mental health conditions when the reaction is maybe appropriate to the circumstance. So just as an example, right, like feelings of intense sadness after a loss is a very normal human experience, a normal human response that doesn't necessarily mean that the person has diagnosable depression. So 2 of the things that we're working on within our own organization are expanding our navigation and referral services, helping individuals to better understand and navigate the mental health ecosystem. We have relationships with essentially everyone on this call. We are not afraid to utilize resources that excel in their particular areas because, again, we none of us can be everything to everyone. So, why not work together to, fill in that mental health continuum? Also, trying to develop programs that teach people the difference between poor mental health and mental illness, provide resources for both, emphasize skill development. Me as someone who went through my own journey starting in my 20s, I had never had any kind of conversations about mental health before, no formal or informal education. I had zero coping skills or any, skills in my own mental health toolkit. And I think that is a really important thing for us to look for in the future. And the last couple things, number 2, in terms of our strategic objectives, we want to use the voice of lived experience to transform the places where we live, work, and play. As I mentioned, one of the attributes that kind of distinguishes NAMI from organizations doing similar work is our elevation of lived experience as a source of expertise. That peer-based model is core to basically everything that we do. So we're looking to better integrate the voice of lived experience into education efforts, more proactively advance advocacy efforts on behalf of NAMI from a national perspective, NAMI from a state perspective, and even use some of those experiences to ideally increase our involvement in some of the county budget processes. And then thirdly, we just want to expand our service region. I mentioned that we serve a 7-county area, and while everyone in that area has access to our virtual offerings, really there's been very minimal engagement with the residents, the service providers, the decision makers in those counties, outside of maybe Dodge and Olmsted, which has resulted in very little awareness of NAMI in large swaths of our service area. So over the next few years, we're hoping to be intentional about building relationships to understand the needs of individual counties, as well as prioritize our own county outreach based on demographics like population, provider ratios, leadership, support of mental health. And then just to wrap up, because I know I'm probably going over time here, quick success. So the success that I always go back to is nearly half of our 13 current staff members, so actually 6 to be exact, actually started out receiving services from NAMI as they moved forward in their own mental health journeys. They moved on to becoming volunteers and eventually moved on to becoming paid staff. And I just think that's a really cool. I think it shows the power of NAMI as an organization, as well as the services that we provide to the community alongside of our other community partners like Zumbro Valley, CIRC. Nicole mentioned that we have peer support specialists that provide peer support to CIRC every week. So I'm just really excited to be a part of this community. So want to thank you all for your time. Be happy to answer any questions you have offline. But for now, I will pass it back to Jen.
Thank you, Matthew. And again, if you're interested in learning more about any of the organizations that are talking today, Ellen has put links to their websites in the chat. So again, feel free, to look them up, to learn more. And again, if you have any questions, please feel free to go ahead and put them in the chat. But we're going to move on to meeting and learning more from Bailey Zeman, a licensed professional clinical counselor who's employed with Olmsted County. She serves as a community outreach specialist embedded within Rochester Police Department and Olmsted County Sheriff's Office, assisting individuals in crisis. She has worked in the mental health field for over 10 years, the past 3 as the community outreach specialist, and before that, she worked in a medical clinic providing outpatient mental health therapy. Welcome, Bailey.
Hi, thank you. It's a pleasure to be here today. I just kind of want to give you all a little bit of a rundown of what a community outreach specialist is. So as Jen said, we are mental health professionals that are employed by Olmsted County, and we are embedded directly within law enforcement for both the City of Rochester Police Department and the Olmsted County Sheriff's Office. We're a team of 4 individuals that respond to crisis calls directly in the field or on the phone, whatever is necessary and needed to kind of meet the needs of the client. Our program started back in 2017, so Olmsted County's kind of been ahead of the game as far as having these services in place. You see them now in the cities and kind of throughout the country as well. But in 2017, it started with one individual who was riding along with law enforcement officers. And then in 2020, we expanded to 4 of us, which is when I had started this position. We are dispatched to calls in the same exact manner that law enforcement is. So calls that come into 911 or the non-emergency number, we all carry radios and are assigned numbers just like law enforcement. So we will respond most of the time is going to be with law enforcement, as a majority of our calls involve high intensity scenarios, weapons, major safety concerns, those sorts of things. Our primary role is to assist with what the client is needing on scene. So I've talked to individuals on the side of the highway, in the middle of a rainstorm, snowstorm, whatever the case might be, as well as in their houses, and just kind of wherever they're at. So we will assist officers on scene. We will help with crisis de-escalation, and trying to navigate and triage what resources may be appropriate for an individual that's in crisis. About just over half of our calls that we go on have a primary reason of mental health. The other 46% that we're kind of seeing a pattern in could be anything from disputes, domestics, fatalities, just a variety of different things, medicals, those sorts of things. So at this point, when we initially started, we were primarily going to person in crisis calls, which are going to be individuals in a mental health or chemical health crisis. And now we've expanded to any type of call that law enforcement is going on. We are also assisting with if needed. We will also do a lot of collaboration. So if somebody has a case manager or another provider through a different agency, we really work to connect the individual with that provider again and circle back. Kind of either reinitiating services if maybe they haven't, or we can place referrals and help somebody navigate starting new services. Just trying to kind of see what's going on, what they might need. We connect families, we connect youth. We have no age limit. The youngest one that I've worked with was a couple months old, all the way up to the end of life. So there's no age restrictions or anything. We can go anywhere within Olmsted County. For the most part, we, like I said, we'll respond with officers, but we are all plainclothes. We are not officers. And so we arrive in like a county vehicle, so that we're easily identifiable. And then we'll work kind of with that individual. There are a good chunk of time that we will start with officers there, and then the officers will leave. We really look at decriminalizing mental health. So some of our goals are kind of that decriminalization aspect based off of the data that we've kind of collected over the last couple of years. So dating back to the end of 2020, when we had our expansion, about 1% of individuals end up going to jail. So we really work on not having that be the outcome. Unfortunately, there are times that that is the outcome, but we continue to work with the social workers directly within the jail system, as well, to make sure that that person can kind of navigate resources while they're there. We'll go meet with them in jail if we need to, whatever is kind of needed in that time. We also collaborate with the Rochester Police Department for the Police Assisted Recovery Program. So that is a program that they fund to help provide fast-paced or fast-tracked treatment beds. So individuals that are struggling with substance use, we've collaborated with a couple different agencies in the Olmsted County area, and will get them into a treatment bed or a pre-treatment bed to start that path of treatment. That's been a very successful program. We've continued to expand on that. We now have peer recovery specialists that will assist in that process. And we have a licensed drug and alcohol counselor that can assist with assessments as needed, as well. Part of that program focuses on individuals who have overdosed within our community and reducing the fatality risk, or numbers that we're seeing there. So every day we're getting reports of individuals that have overdosed. And then we're doing outreach with those individuals to kind of help get them into treatment, doing education about Narcan, and just about treatment in general. So really, our goal is trying to meet people where they're at. We primarily collaborate with the Rochester Police Department, the Olmsted County Sheriff's Office. We also have collaborations and go out on calls with the Rochester Fire Department, as well as with the Mayo Clinic Ambulance Service and their community paramedics. So at any point, we could be out on a call with any of them, all dispatched in the same regard. So we're able to really just connect with individuals regardless of what's going on. One of our other goals is really looking at, like I said, that triage or referral mechanism. So what people might need, as it's been mentioned, getting mental health services can put you on a long wait list. And unfortunately, that can take some time and people are susceptible to being in additional crises. And so we really try to help triage some of those scenarios. If somebody needs a higher level of care, such as going to the crisis center or going to the hospital, we will work with those partners and collaborate with them on what we can do. We'll let them know kind of what's been going on. We'll help bring individuals there if need be. And then just kind of work on that treatment plan thus far. And then once they are discharged from those facilities, we try to connect with them again, just to make sure that we're understanding of what the treatment plan is, or what the discharge plan is, so that should we encounter that individual again, we're able to kind of circle back and talk with that individual and get them back on track. As Nicole has mentioned too, weekdays are a busy time. Every year we've noticed that about Tuesdays and Wednesdays, mid-afternoon to early evenings are a busy time. We've collaborated with individuals up towards the cities that are doing similar co-responder models, and they have similar data. So whatever it is about Tuesdays and Wednesdays, kind of midday, tends to be at least for Minnesota, a trend that we're seeing. So those are kind of a good gist of everything that we're doing. We keep track of a lot of our data and look at demographics and try to make sure that we're responding to individuals regardless of the demographic, what they might need. So really meeting that underserved community as well. Individuals that may not have access to services. Typically, we know transportation is a big issue that's been discussed. And then just access in general tends to be problematic. So we will continue to connect with anybody that client is needing. We don't have the ability to take on a full caseload because there's only 4 of us and responding to kind of daily crises. However, we do have some capabilities to have a follow-up component with individuals. So those who are experiencing some significant crises, and then maybe we were able to divert them from a higher level of care, we are able to kind of check in with that individual, see how they're doing, continue to talk about the safety plan that we have created with them the following day, and just really kind of have that holistic approach and touch base with them on what we can do to help them in a difficult situation so they don't kind of continue to circle down that path. We really just try to work towards meeting the needs of the person. So every call is different. Every call is very unique. We never really know what we're going to get into on a daily basis, which kind of makes the work all the more exciting. So we're available as much as we can be. Unfortunately, we're not 24/7 at this point, but the hours that we are currently working are based upon where we've seen the increase of calls and where the highest need is for the community. So we keep track of all of law enforcement's calls that they're responding to within our community, and then we adjust our hours accordingly based on the patterns that we're seeing. So right now we're primarily working during the week from 7 o'clock in the morning till 10 o'clock at night. And then we have shifts on the weekends on Saturday, primarily from 11 o'clock till about 7 p.m. So really trying to meet the need there. If for whatever reason we're not available or we're not able to kind of respond to the call because we're on a different call or whatever the case might be, officers will send us information, dispatch will send us information, and we'll follow up with that client if it's not one of those urgent circumstances. We do get calls quite often about asking about resources within the community. We do a lot of education for families, talking about commitments and holds and forcing individuals to kind of receive care. So we'll talk with individuals. We do welfare checks on a daily basis for individuals. I think we've got A majority of our calls, like I said, are mental health, and then we kind of lead down into welfare checks, which are similar to mental health, but a little bit different because there's not always a mental health component involved in some of those. Working with individuals that might be having some cognitive impairments, whether it's from a substance use or a cognitive disorder. We do a lot of work within our school systems too. So we connect with the school resource officers. So if students there are having some struggles during the day, we can connect with them. Or if they're having issues at home, we'll connect with them too. That extends, like I said, throughout all of Olmsted County. So we've got Rochester Schools, Byron Public Schools, Stewartville, Pine Island, Dover, Yoda, all of those areas that we try to touch base on. We also connect with the hospital resource officers. So Rochester Police Department has officers that are directly embedded within St. Mary's and Mayo Clinic, as well as ONC. So we're working on adding all of those together. The primary way to kind of get a hold of our team is to go through dispatch. That's going to be the fastest, most guaranteed route because that's how we are dispatched to calls. We do have additional team phone numbers and team emails that people can reach out to us, but those aren't used for an urgent basis. Those are more as far as a resource base, and I can add those to the chat later. But that's kind of a gist of our team, and we're always willing to help where we can and trying to meet you where you're at.
Thank you, Bailey. It's really incredible to have learned a lot so far this morning about all that's available to support members of our community, the breadth and the depth from, again, but the one thing I've heard a lot from each of you is meeting individuals where they're at and primarily focus on each individual needs. So we're going to switch gears just a little bit and welcome Matt Coy. He'll be our final speaker with us this morning. Matt will talk about mental illness, mental health, and his experience as a bereaved parent, patient, provider, and advocate. Matthew, his wife Michelle, and their daughter Morgan live in the area and lost their only son Wyatt to suicide in January of 2017. The family has endeavored to use their circumstance to shine a light on the mental health epidemic we are facing in our country. Through the Wyatt M. Coy Memorial Scholarship Fund, which is administered here at Rochester Area Foundation, legislative visits, public events, and various speaking opportunities, the entire Coy family hopes to increase awareness and education about mental health in an effort to prevent other families from suffering this type of loss. By day, Matt is an entrepreneur owning and operating a manufacturing and distribution business in West Concord. He serves on the West Concord Volunteer Fire Department and Ambulance Service. He is an NREMT certified emergency medical technician and is known for embracing a patient-first mentality in the field. His ability to thoughtfully manage critical incidents as well as his plain-spoken nature serve him well in this role, especially during mental health incidents. Welcome, Matt. I can see him there. There we go. Matt is joining us from not from West Concord. He's in Phoenix. So there we go.
So if you see my video feed go away, that's why. And I think I'm actually going to do that now. Just a little bit with technology. So I'm going to go ahead and pause the video portion of my end so you can hear a little bit better. So let me know if something changes on your end so I can make adjustments here. Okay, can everybody hear me okay?
We can hear you.
All right. Thanks. My name is Matt Coy. Good. My name is Matt Coy, coming to you from Phoenix today, resident of Manorville, and am just plain honored to be included in this group of professionals, and the knowledge base that's here is being included with that is truly humbling. So I thank you all for that. As Jennifer mentioned, we lost Wyatt in early 2017. And Wyatt had struggled with depression for 3 or 4 years. Wyatt's care team and care plan was handicapped by a lack of access. and a lack of providers. And in the months and years after our loss, we wanted to do something. Actually, shortly after Wyatt's death, I was talking with my cousin who had lost his father. And I just asked him, I said, Steve, what am I supposed to do with all this? And the response I got was formative, and just plain simple. And that response was, well, seems to me the only thing to do is to make something out of it. So when the opportunity came to the forefront to honor Wyatt in a way that he would appreciate, in the way of a snowmobile ride, a memorial ride, we kind of jumped in with both feet. And Wyatt was an avid snowmobiler. Wyatt was a helper at heart. He was his very best when he was helping others. He was always tuned into other folks. And when the steering committee for the ride started talking about registration fees and this kind of thing, that nearly stopped the entire process, because I didn't want anything to do with money. And then it was presented to us that maybe we better do something with those dollars and use this to build something and do something with it. We then reached out to a couple of similarly bereaved parents in the area, and one happened to be a board member. And I asked Mary, I said, I do a scholarship. And she says, yeah, you should talk to RAF because they do a really good job. So we met with Ellen Heggie early and learned about the scholarship programs at the Rochester Area Foundation, and came away from that initial meeting absolutely deflated, because the buy-in, if you will, for an endowed scholarship program just seemed unattainable. But my wife and I put our heads together and said, it's probably going to take 5 or 10 years, and we'll just use all of our tax refunds, if you will, and we'll get this thing done. And I was as surprised as anyone when, after the first ride for Wyatt, we had already raised enough to open the scholarship fund. That continues to amaze me. And as of yesterday, and I see that the good folks at the foundation are processing some contributions to the fund yet today from the 2024 ride. But as of yesterday, the fund is now in excess of $164,000, which is just unbelievable. And as an endowed fund, this is, I should take a step back. The scholarship program is designed to assist local students who are pursuing a career related to mental health, whether that's psychology, sociology, social work, law enforcement. There's many different pathways someone interested in making an impact in mental health can take. But this scholarship is intended to assist those folks from the local area, because Wyatt's experience was riddled with access problems. So to have that endowed fund is important to us because Wyatt was a helper, and this endowed format allows him and his memory and his legacy to help people forever. This past year, we were able to raise an additional $50,000 that will be split between the scholarship fund and donations directly to the American Society for Suicide Prevention, or the American Foundation for Suicide Prevention, rather, the AFSP, in their work with research and legislative lobby. And we're just plain humbled at the support of the community, the job that all of the presenters here today are doing in addressing the critical needs in mental health in our communities, and especially in rural and outstate areas. I am far less eloquent than any of the other speakers presented here today, but I can say that our appreciation for the work that is being done and the reduction in stigma that is taking place in our society currently, because of the work that you good folks are doing, we are so very, very grateful, and we are grateful to the Rochester Area Foundation for making it easy for Wyatt to help. And that's what we do. That's what we're about. And I'll leave it at that. Thank you again so much for having me today. Truly humbling to be included in this learned and expert group.
Thank you, Matt. And thank you for taking time out of your vacation to join us this morning, and for sharing your story with us this morning and over again, for taking a tragedy and a loss so incredibly personal, and making that decision. You've heard, again, barriers to care this morning, and you identified a key one. We don't have enough providers. And so your family said, we're gonna help create more providers. And you're doing it in such a way of supporting students, and helping them be able to access their dreams, and pursue their passions and get their educations, so that one by one, we will have more providers and we will have more access to care. And it is incredible. And I to know the journey that you and your family have been on, and we've been a very tiny part of it, but to watch the love around your family, and the love that is felt for Wyatt every single day has been incredible. So thank you for all that your family does. And it isn't a tiny thing. It is one big gigantic thing. And it really is making a difference. And it is every bit as important as the work of Zumbro Valley, of CERC, of NAMI, the work that Bailey and her team do. It's different, of course, but it is every bit as important. So thank you to each of you for the work that you do. Again, very different, but meeting needs, meeting people where they're at. And as a community convener and a community foundation, we are so incredibly grateful for the roles that each of you play. So thank you very, very much for sharing with us this morning. Again, there is in the chat all sorts of information from each of our presenters, as far as where you can find them. If you have questions, feel free to reach out to each of them, or you want to get connected, reach out to us, and we're happy to make that connection for you. So thank you so much for sharing this hour with us for our March Coffee and Conversation. We hope you will join us next month, April 3rd. We will again talk about Earth Day and sustainability and all that's going on in our community to care for each other in a different way by taking care of our environment. So thank you so much to each of you again, and we will see you in April. Until then, enjoy today's sunshine and have a great day. Thank you, everybody.